This report is designed to fill a gap, an information gap. The federal government has never published a comprehensive study of the fiscal cost of immigration. No public policy has changed the size and composition of the U.S. population as much as immigration policy. Today, 1 in 8 people living in the United States are immigrants. 40 years ago, only 1 in 21 U.S. residents was foreign-born. Immigrants and their children will account for more than 80% of U.S. population growth through mid-century. Immigrants are poorer, they pay less tax, and are more likely to receive public benefits than natives. The Jordan Commission found that the average immigrant household receives about $13,000 in federal benefits, while paying about $10,000 a year in taxes. That's a deficit of $3,000 per household. That was more than 10 years ago. In the past few years, when we were discussing immigration legislation in Washington, there have been other studies, but they were done by private public policy think tanks like Heritage Foundation, for example. In the past few years also, state and local governments have issued reports on the impact of immigration on their budgets. They all reach pretty much the same conclusion. There's a negative fiscal impact, with immigrants receiving more benefits than they pay in taxes. Now the federal budget is full of analysis. There are a lot of fiscal analysis in the federal budget. You want to know the cost of Homeland Security policy, changes perhaps in Homeland Security policy, or mortgage policy, or federal credit policy? Well, there's a section of the budget that deals with those issues and explicitly provides the analysis of the cost of changing those policies. Even drug policy, the war on drugs, there's a section of the federal budget, every year, that's devoted to the war on drugs. But immigration policy, nothing. Most recent studies focus on illegal immigration. I think that's too narrow. There are plenty of reasons to be concerned about illegal immigration, but almost all of them are also reasons to be concerned about legal immigration. Anyone who is concerned about the impact of illegal immigration on wages or assimilation or on the federal budget should also be concerned about the impact of legal immigration on those things. So our report measures the total cost of immigration, the cost of providing for all 37 million immigrants, legal and illegal, in the country today. We believe that every federal agency and most federal programs are impacted by immigration. And this report contains 15 sections, 15 fiscal impact statements, one for each cabinet-level department. By casting a wide net, we are able to discuss programs that are not normally associated with immigration. We're sort of raising the awareness of the pervasiveness of the impact of immigration on various aspects of the federal budget. For example, the Earned Income Tax Credit. This is administered by the Department of the Treasury. It's the most expensive, means-tested cash welfare program in the federal government, but very few people have heard of it because it's embedded in the tax code. You don't even have to file for this. It's simply something that automatically comes to you if when you pay your taxes, if you're eligible for it. 30% of immigrant households receive the Earned Income Tax Credit. Only 10% of native households receive the credit. And illegals can even receive the Earned Income Tax Credit on behalf of their U.S.-born children, which is rather extraordinary when you think about it. The Environmental Protection Agency spends more than $1 billion annually to reduce the nation's carbon footprint Well, we actually use less energy per capita today, matter of fact, significantly less energy per capita than we did in 1974 when pollution became a big issue. But population growth has more than offset the decline in the per capita usage or the per capita effluence of greenhouse gases. So the bottom line, as far as EPA is concerned, it should be aware that its goals are unattainable as long as the U.S. population increases at its present rate, and immigration is the prime mover as far as the growth in overall population in this country is concerned. You wouldn't think that the Department of the Interior, just given its name, is part of the budget that would be impacted by immigration. But there is a unit of the Interior Department called the Bureau of Land Management that spends millions of dollars a year to clean up the debris that immigrants leave when they cross the country over the southern border. I don't know if you've seen pictures of what the border between Texas or Arizona and Mexico looks like when it's been recently trampled on by immigrants. It is absolutely filthy. They're literally feet, 1 foot of garbage bags for an extended amount of area, and that's again a small example of the pervasiveness and the insidiousness, you might say, of the costs that are imposed on at the federal level by immigration. U.S. hospitals must provide emergency medical treatment to illegal immigrants. The Department of Health and Human Services provides $250 million a year to help hospitals pay for this mandate. But the real costs are far greater. But these are mandated on state and local governments for the most part. These are costs that hospitals in California have had to endure for years, and they've put many of these hospitals out of business, actually. Emergency rooms have closed because of the mandate that they make themselves available for illegal immigrants. So that's one example of how the true costs are much larger even than are reflected in the federal budget, because the government can mandate that other units of the federal government can mandate that other units of government has to provide services for immigrants without actually providing them the funding to provide those services. The Department of Education distributes migrant education grants to help states educate the children of seasonal farm workers. But the funds are distributed based on the number of eligible students rather than the number actually enrolled. And this creates an incentive for states to overcount and underserve migrant children.